I'm hoping everybody can hear us okay. In the meantime, I guess I'll just go ahead and give a little bit of an introduction to who we've got here with us today, and then I'll stop talking because that I'm not who we're here to see. So kia ora, everyone. Thank you for joining us today. Really appreciate the great turnout and in amongst your extremely busy schedules. I'm Alex Cobble-Champagne, Medtech's Integrations Program Manager, and today we have with us Cecilia Harris, Justin Begg, and Andrew Howard from Echo Health, which seamlessly integrates with Medtech Evolution via our interoperability platform, ALEX, not named after me. I'm sure there will be many questions and a lot of great feedback coming up throughout the webinar. So as these do pop up, please do feel free to pop those into the Q&A box down the very bottom of your screen if you see that. And the Echo Team Health will aim to get through as many of those as we possibly can. There will be a Q&A session at the end of the webinar. So we'll hopefully get through those either during the webinar throughout or at the end during that session. In the event your question or any questions you might have on behalf of your colleagues who were unable to attend, we will ensure that we get contact details and those question details sent through to the Echo Health team following the webinar. And these will be followed up essentially after the webinar. Anything that doesn't get dealt to during the session will get dealt to, just may not be able to handle it during this particular session. Also, for any who do have colleagues or associates who were interested in joining us today, but who are for any reason unable to do so, we are recording this session, so we are, of course, happy to pass this on to anybody who's interested. So without further ado, I'll hand off to Cecilia.
Thank you, Alex. Thank you all for joining today. We're very excited to present Echo Health to you today, and really do appreciate you taking time out of your very busy days. If I could just get a thumbs up from my team or Alex that the slides are up. Are the slides sharing or no? Okay, that's why we check here. And how are we going now? We've got slides. Amazing. So thank you for joining today. And we've got our webinar outline. So what are we going to cover today is we're going to talk about, why the AI scribe exists. It's a research-backed problem. Why adopt an AI scribe? Why us? And why do we exist? How the Echo Health and Medtech integration works, what we do. I know there'll be a lot of privacy and compliance questions, demonstration, pricing and launch offers, and of course, ending off on Q&A. So joining me today in my team is, excuse me, I've got to hit a button. Is Andrew Howard, our digital health lead, who's going to moderate and do our Q&A questions for us. Justin Begg, who's our corporate development lead, and Justin is going to play the patient today. So Justin is really looking forward to that, I know. And I'm Cecilia Harris. I'm the CEO and founder of Echo Health AI, and I'm very excited to be presenting our solution to you today. So it's a research-backed problem. Echo Health, as we're going to talk about, handles both sides of people in the consultation. It's not just about the clinician and the clinician notes, but the patient as well. The New Zealand Health and Quality and Safety Commission say 50% of patients forget what their doctor says. We've got a lot of research on this, and often up to 80% of patients sometimes forget what has been told, and definitely sometimes the specifics of what has been told. There is well-documented data on the fact that GPs are spending 6 to 9 minutes on documentation per consult. We know that there's, with limited health literacy impacts, medication adherence, rebooking and referrals lead to have real impacts, and we aim to address this. So why Echo Health? Well, as I said, we wanted to look at it from both sides, both the clinician and the patient. So we're really aiming to reduce that admin fatigue. We know GPs spend up to 2 times as long documenting as comparing to consulting. We want to be able to make sure clinicians can spend more time face-to-face with their patients rather than the documenting side. But we also want to improve patient understanding. So we want to close the gap between notes, action, and follow-up. And we come at this from the perspective of trying to meet the quintuple aim. So what is the quintuple aim? It's about supporting clinician wellbeing, improving patient experience, reducing healthcare costs, enhancing population health, and advancing health literacy. And the majority of the AI scribes that are out there are really focused on point number 1, which is supporting clinician wellbeing. And we are as well. We want to make sure that those notes are done quicker. We want to reduce the stress, the administrative burden, and we want to improve that job satisfaction for healthcare professionals. But we also want to improve the patient experience. So we want to give the patients plain language summaries, SMS reminders, instructions empowering the patients, and then reducing their stress as well. We want to reduce the overall healthcare costs. If patients remember what they've got to do, they're going to not miss their doses, their appointments, and stop having preventable, avoidable hospital visits, saving the health system lots of money, and that's really critical these days. And then enhancing population health. So with our structured action plans, SMS reminders, we know patients are going to follow their medical advice better, leading to better outcomes and fewer preventable complications. And of course, advancing health equity by using plain language and having multilingual support and digital delivery. We bridge those literacy gaps, language barriers, and create a more inclusive, patient-centered care. So we're focused on all of those components with our solution. So why us versus the competitors? We're not just an AI scribe. We really focus on that key component of connecting care. So it's designed with both the clinician and the patient in mind. We listen to the consult, and we pull all of that together to create health summaries and action plans for the patient. It's medico-legal auditable timestamps. Everything is approved by the clinician. Patients don't need an app or a portal to get the information. It's frictionless. From the clinician perspective, it is highly customizable, structured or free form. What is it that the clinicians want? And we'll go through this in a bit of detail. We have the option of prompts, notes, and templates, all to pull that documentation together in a way that is useful for you as the clinician. So what have we done with integrating with Medtech? I'm sure a lot of you are already aware of the ALEX background, but what it is a native FHIR-based integration into Medtech Evolution. What that means is it's safe and secure. So we pass the patient context from Medtech. The data is encrypted, both at rest and in transit. There is no disruption to your workflow. It opens within Medtech Evolution and updates the daily record as part of the workflow. We support New Zealand standard formats, and in the case of Medtech, we have the default of subjective objective because that's the structure that is the default, but we can also have other options depending on what your requirements. And we're going to talk about a little bit this later, but we can also update to the outbox, and that's currently in beta. So what does it do? Once again, it listens to the consult. It generates those clinical documents, notes, templates, prompts, patient-friendly summaries, to-do lists, reminders. They're sent to the patient directly. We're also very excited to be saying that we're working with Healthify for patient resourcing. And you'll see when we demonstrate this that we'll be bringing up patient resourcing from the Healthify website that can be then easily on-sent to the patient. And on that note, going to jump into a demo. So I'm just going to stop sharing my screen for 1 second and open up a new screen.
Just while we wait for that, I'm just going to ask a quick question from Kay. Kay Brittenden, I'm hoping I'm saying that correctly. She's asking if they can get a copy of the slides after the webinar. That's all.
Absolutely. Absolutely. So there'll be no problem on that. And just checking, Alex, while you're not on mute, that the screens all come up correctly. Excellent. Justin, you get ready to go. You're gonna be the patient.
Yep, I am.
So you should all now be familiar with where I'm at. Obviously, I'm in a sandbox version of Medtech. So keep that in mind when we're going through this today. So let's get going with this. I'm going to sort of preface this by saying we are incredibly scripted with what we're going to go through today. And the reason we're going to be scripted is because we really want to make sure that we highlight everything that can happen within the system. So we're going to show you what a free-flowing conversation feels like while we're detailing quite a lot of medical information and also giving information back to patients. So Echo Health sits within the ALEX apps, and we can just click on that and it will open it up. Most importantly, you need to be in a patient to open it up, because what we are doing is that we're passing both the patient and the provider information through as we open it up. So if you open it up without the patient being open, it won't pass through that information. You don't need to then log into the system. The system looks at that provider ID from ALEX and checks in our system, is there a user set up, and do they have an active subscription, and we'll then log them in straight away. So from there, we click on the patient. And what's happened is that we're bringing up a file number, and you'll see that file number and you'll go, oh, that's a very big number that means nothing. It's deliberate. We don't want to bring over any information that is not relevant. So we don't take the NHI number over into our system. So we don't want to pass any patient identifiable information back into the AI. So what we're doing here is we've got key components that we need is the gender, just so we get our documentation correct, and then the mobile phone number. As our system has the option to send SMSs to the patient, it is critical that that mobile number is correct. So once I've done that, I'm just going to click on update the patient details. And then from here, we can start our consultation. So, hi, Justin. Thanks for coming in. How have things been since we touched base?
Yeah, not too bad. Just ticking along, really. Bit tired lately. Work's been full on.
Right. Well, how's the energy been day to day?
Oh, variable. Mornings are fine, but about 3 or 4 in the arvo, I'm dragging. I've started needing a second coffee, which I never used to.
Okay. Well, that sort of fatigue can sometimes be linked to blood sugars being a bit elevated. Are you checking yours regularly?
Yeah, I try to, not every day, but maybe 3 or 4 times a week, usually mornings.
And what do those numbers look like?
Mostly 7s, sometimes 8 point something, once or twice in the 9s, usually after a bigger dinner or some takeaway.
Got it. Any readings that have been lower than expected, like in the 4s or the low 5s?
No, haven't seen any of those for ages.
Have you had any signs of hypos, like shaking, sweating, sudden hunger, lightheadedness?
No, nothing like that.
That's good. What about sleep? Are you sleeping through the night?
No, sort of. I fall asleep okay, but I tend to wake up around 2 or 3 a.m. Sometimes I go straight back off to sleep, but other times I'm tossing and turning for a while.
Any ideas what's waking you? Needing to pee or just restlessness?
No, a bit of both, to be honest. I usually get up and go to the loo, but then my brain kicks in. It's hard to switch off.
Well, that's pretty common. Often it's connected to stress or blood sugar fluctuations overnight. I've had a look at your bloods. Thanks for getting those done.
Yeah, I just did them last week.
Okay, so your HbA1c has crept up to 58. That's up from 52 6 months ago.
Oh, okay. That's not ideal.
No, not panic stations, but it is edging us out of the target range. We try and keep it under 53 to reduce long-term risks, kidneys, nerves, eyes, heart, all of that stuff.
Yeah. What about my cholesterol?
That's gone up a little bit as well. Your LDLs is sitting at 2.7. Ideally, we'd like that under 2.
That's probably from the food. We've been getting a bit lazy with cooking.
Understandable. It's a bit hard to keep up with it all the time, especially when life's busy. Tell me a bit about what you've been eating and what it's been like the past few months.
We do okay during the week, usually meat and 3 veg or maybe a stir fry. But weekends tend to be a bit rough. I end up eating pies or burgers, especially when we're out and about. I've also been having biscuits with tea more often. It's just habit.
Are you snacking in the evening?
Yeah, especially when I'm watching the cricket or something. Chips, crackers, that sort of thing.
What about your portion sizes?
No, probably too much. I go back for seconds, especially if I like it.
Okay. Any sugary drinks?
No, just water and coffee. Maybe the occasional Coke Zero.
Alcohol, do you drink much of that?
A couple of beers on Friday, Saturday. Sometimes have wine when guests come over.
Okay. And what about exercise? What's your routine at the moment?
That's the thing. I haven't really got one. I used to walk the dog every morning, but with the darker mornings, I just haven't kept it up.
How's the dog coping?
Yeah. Yeah, she stares at me accusingly, but she's getting older too.
It'd be great if we could build that back in. Even 20 to 30 minutes walking most days would help with energy, sugar levels, and cholesterol.
Yeah, I know. I just needed to make it a habit again.
Do you have any gym memberships or classes?
No, it's not really my thing. I used to play squash in my 30s, but my knees just can't take it anymore.
Fair enough. Look, even a brisk walk with a podcast counts.
Yeah, it's a good idea, actually.
Okay, let's talk about metformin. I can see here you've been prescribed it. Are you still taking that?
Yeah, 1 gram twice a day. Haven't missed a dose.
Great. Any gut issues or side effects?
No, it's all been fine.
And we're still not on any other diabetes meds.
No, I remember you mentioned that might be an option if things don't settle.
Exactly. If your HbA1c stays up, we may look at something like a DPP-4 inhibitor or a GLP-1, depending how things go. But we'll give lifestyle another solid push first.
Sounds fair.
Okay. So your blood pressure today is 132/78, which is great. Your kidney function is stable, no protein in the urine, and your eGFR is sitting at 82.
Oh, good. I worry about that sometimes with my uncle having kidney problems.
Well, that's why we check it and you're on top of it. Do you remember when your last diabetic eye check was?
Oh, maybe 2 years ago. I was supposed to go, but I never last year, but I never booked it.
Okay, well, I'll refer you again. And for your foot check, the nurse should be able to see you next week if you're around.
Yep, I can pop in.
Any numbness or tingling in the feet or legs?
No, I feel fine.
Now, just checking, you're not getting any chest pain, breathlessness, or cramps in your calves when walking?
No, all good that way.
And mood-wise, how you been?
Oh, bit flat some days. Work's pretty stressful. The boss is short staffed, so I'm doing extra hours. that's probably why the diet's been all over the place.
Yeah, that makes sense. Any worries about depression?
No, I don't think so. I've had mates go through that sort of thing. I still enjoy things, just feel tired.
Good to check. All right, shall we put in a plan in place for the next few months?
Yeah.
First, get back to walking. 30 minutes a day, even if it's broken up into chunks.
Right.
Second, focus on cutting back those portion sizes, second helpings. Keep a rough log of what you're eating for the next 2 months.
Okay.
Try and limit those evening snacking to a couple of nights a week. Maybe swap in chips or nuts. So swap the chips to nuts or yogurt.
Yeah, it's doable.
And keep checking your sugars. Aim for morning one or two post-meal readings a week.
Yeah, got it, doctor.
Right, well, we'll recheck your HbA1c and your lipids in 3 months, and if they haven't come down, we'll look at medication options.
Yeah, makes sense.
Great. Well, I'm also going to include a link to Healthify NZ, which can also give you more information on diet and exercise. So that will come through to you as well.
Sweet.
And remember to book the referral for the eye check next week and do the nurse foot check next week as well.
Right.
All right. Well, I'll also send you an action plan of what you need to do today. But if you get stuck or anything changes, please don't hesitate to contact us.
Yeah, thanks. Actually, it feels more motivating once we talk about it.
Great. Thanks, Justin. So thank you, Justin. Thanks for doing that. Much appreciated. So once the consultation is completed and submitted, Echo Health will start processing the transcript. This usually takes between 15 and 20 seconds, depending on the length and complexity of the consult. So what it's going to do first is it's going to jump to our Echo Scribe assistant. And what that is doing is pulling up a default prompt that we've got in the system. So you're going to hear us talk about 3 key things when we talk about clinical documentation. We'll talk about prompts, we'll talk about notes, and we'll talk about templates. And this particular prompt, designed by a New Zealand GP, is about combining the issues together, and we've got then the information here. So diabetes management, sleep disturbance, lifestyle and exercise, the observations, and then a plan. Now we can update this directly into the daily record within the system. So we can hit update notes and that will go into the daily record. So I'm going to hit that and then I'm going to open up the daily record. And you can see that that has updated into the system there for you. You can also see that we've done quite a few tests, so we've got very similar notes in here. So that has come through straight away. Worth making the observation that with the observations, when they come through, they won't update automatically into the screenings until you hit return within there. So going back, so not only have we got the documentation instantly updated into the system, obviously you need to read it, check it, and all of those things. But at the same time, we've also looked at the patient, what's happened with the patient. So what is our patient's literacy, sentiment, emotion within there? So what we've got here is a summary of what's been said. So during the consultation, the patient discussed feeling fatigued, especially in the afternoons. And we've just given that 100-word summary of what's actually happened within there. Within here, we've also got the to-do list. So really going through all those key actions that were identified for the patient within there. We've also then come out with, it's identified that we talked about diabetes, It's looked at our system and it's pulled out the Healthify diabetes page, which can then be sent to the patient. So we're working with Healthify to have all of this information. So we identify the disease and then we put the resource up, and that can then automatically be sent to the patient. You stay in control of all of these components and you can edit anything within here. You can also choose what you want to send. We might feel in this particular instance, the summary is not particularly useful, but we definitely think the to-do list for the patient is going to be critical. So we can click on that, and we definitely want to send the Healthify information. And then we can hit send SMS. Once again, all of this is customizable. We can add in any further information in there. We won't actually send the SMS because it's a made-up phone number in the test system, but that would go straight through to the system. At the same time, what we're also doing is we're looking at those to-do lists. Is there ones that would be really relevant to send SMS reminders to? And we can choose to send these reminders within here. So we can go, actually, we want to send the nurse one. We want to also send the recheck the HbA1c. So as a clinician, you stay in complete control of this information. So you can choose to send it or not send it, depending on the requirements of the patient. Now, obviously, when we send this, it's secure, it's date stamped, and meets all the medico-legal requirements. We also then have notes. So what is the difference between notes and the prompt? The prompt is a little bit, I think if you hear someone sort of say, I want to train my AI, that's about getting your prompt specific, whereas the notes are structured in a format that is determined for the system. We have a number of ones that we can change if we want to, and then these can also update directly into the Medtech system. And what the difference is there is that we'll actually go from the observation, so subjective and observation, rather than this one that just went into the subjective, this one went into the observation field as well. We also then have templates. So these templates, we have a number of standard templates, but these are about what is relevant to your practice, and we define them with you. So if I go have a look at what a chronic disease management plan will be, it'll regenerate it, and it will regenerate it in the correct format here. So what's our medications? What's our goals? What's our lifestyle? What allied referrals? So these headings have been chosen, and we can define these with you, and these can be set up to your requirements. What I'm now going to bring up briefly is a couple of things that are in the beta, which we're hoping to bring on in a short period of time. So with this little paperclip here, we can add in additional context. Now, this is one of the real advantages of an integrated solution, is instead of having to add in this information because you want it added into your clinical documentation, you can hit the refresh button, and it is now pulling this data directly from the system. So it wasn't 1 gram, it was 850. But they also have an allergy. It's picked up the blood pressure readings. It's also picked up our notes in the system, and we can update this into the system. What this then means is that we can go back and look at a different template, and it will pull the 2 lots of context, not just what was said as the ambient speech, but as the context as well. So in this particular example, we didn't discuss the penicillin allergy at all, but it's pulled up and it's in the documentation. what we can also do that is in beta at the moment is that we've got a response. So we've got all this information that we want, and we want to put that in a document. So we can create an outbox document here for the patient. So once again, if I go back to the daily record, that one there, and we go to the attachment, and there we've got out what we've discussed from the template. So the template has updated. Now, importantly, you can see this does have now the NHI number, does have the patient, the provider information, but we aren't pulling this, and this is not going into the AI system. So we pulled this directly from ALEX to make sure we have a secure solution here for you. As I said, this is in beta, so it needs to be a little bit prettier, but we're working through that at the moment. So just one final feature I just wanted to go through with you was the smart dictation. So perhaps not just the context, but perhaps there was some specific information that the doctor wanted to observe post the consult. You can then do a smart dictation of what that is. You can update that into the consultation. So then if you run your templates or your notes again, that will be added into it. You can smart format, and you can actually then post it into other systems as required. Probably the one other observation to make is that if you are using the SR referrals, if there are components where, it's already, the SR referrals has done most of the work, but you want to put in some free-form text, all of this is copyable. Each of the sections are copyable, I don't know if that's a word, into the SR referrals there. I'm just going to end by saying we can be customizable, flexible. We can set up your system to meet your requirements. We have a lot of settings in the background here, which is how do you want your documentation to feel detailed, empathetic? What is your structure? How is it that you want everything to go? We have the ability to set up templates that meet your system. We're going to talk a little bit about onboarding in a minute, and we will cover this off in more detail through the onboarding process. So I'm just going to have a moment, stop that screen, and get the PowerPoint slide back up going.
Cecilia, it might be good to answer just a couple of questions in the Q&A right now, just that,
Sure.
as you went through the demo. So first question, will you be able to open the specialist referrals while EcoHealth is open? So I'm assuming that means, the question there is, can you have the referral in Medtech and the templates structure that you've got within EcoHealth?
I might actually need to defer that one to Alex, but I believe so. The reason I can't answer it is I don't have an active license for that.
So that one I'm hesitating to say yes. This is something we'd have to check. But my suspicion is no, because SR is also an ALEX app. So as a result, you can't have more than one ALEX app open at the same time. So that particular instance, I suspect will be no, but that's something we double check. So certainly how it goes.
We'll follow up on that.
Mm-hmm.
This next question, I'm not sure, that might need some clarification here. Does it count as an advanced form? And can we have other advanced forms open? Alex, I think you probably just answered that, right? Which is...
So the advanced forms I'm not too familiar with, as they're not really as much of an integration from the ALEX perspective. Those ones might be, again, that's kind of a similar, we'd need to double check that. But that one I think is I'm more optimistic about than SR, given that SR is an ALEX app. I'm suspecting that won't be the case, but advanced forms are not ALEX apps. So it very well might be that that'll be just fine.
So I haven't checked the advanced forms, but I do know you can open up multiple windows within that patient context. So you can have the advanced form, you can have your medications. So as long as it's a separate window, yes, you can. That is it. That's the question. So the question is, does it open as a separate window within the patient area? And if it does, then we're actually fine with that. So, but we will check with the Medtech team and come back to you on those two things. So,
Cecilia, there's a few more.
Okay.
these are all specifically around the demo. So next one is mobile is not unique for a patient, e.g., the parent or the kid. Is there any concern around using the mobile number?
So obviously, when they're held in our system, they're held as the patient identifier. So we're not. So we can discern the difference between them. It is on the onus to check that you're happy for that SMS to go to that mobile phone number. And where it is a child, obviously the parents can consent to that.
And can you send via email instead of SMS?
We don't have a native email app email within the system at the moment. Our view is the SMS is actually more secure than the mail. However, it certainly all can be copied and put into an email, and it's certainly something that we can put on the roadmap if there is strong feedback for that.
Great. Is there a limit of characters for the SMS?
So a credit is 160 characters, but the SMS can be more than 1 credit. So if you look up on the screen that I've just put up now, so as I said, we've been doing quite a few tests. So this was one we did earlier, and I took a screenshot when I sent the SMS to my own phone. It can be like we've sent ones that take up the whole page, and that is fine within there. So it will use more than 1 credit, but it can be longer than 1 credit. So it can be longer than 160 characters, I think, is the answering that question.
Okay. There's a few questions which we'll answer later in the presentation, so don't feel that we're not covering ones that you've answered. But one here, does the AI enable script generation or just record the notes?
Can you just repeat that back to me, Andrew?
Does the AI support generating a script?
The transcript?
No, as in a medication script.
Oh, medication. Oh, prescription. Not at the moment, no. There is a request that can happen, and once again, that's something that can go on the roadmap, but it does a little bit. I don't think at the moment the API ALEX necessarily allows that, but it's something on the roadmap that not the first time I've been asked that, but at the moment, no.
Great. I think we'll call it there. There's a few other questions as we keep going, and I think you'll answer the rest as we talk about privacy and other issues.
Great. Okay, so just wanted to make sure we do this presentation and we don't hit SMS, and I know one of the questions is what does it actually look like? So I just wanted to put up a screenshot of that there. So then getting on to the privacy and compliance, because that is always a question. You do need to ask the patient for consent within there. So it is the onus on the clinician to ask for consent. It can be implicit. I've said explicit, but I believe New Zealand actually also allows for implicit consent. So a form in the waiting room would be enough. However, it is best practice to get explicit consent. We can help provide forms for those as required. The audio, we don't keep the audio. So it's never stored. The file is never stored. We never have the audio. We do keep the transcript for 30 days. So you can go back and you can generate clinical notes after that time. We don't keep them after 30 days. We can also allow you to change how many days you want to keep yours for, but 30 is the limit on the transcript. We do, however, keep the summary and the to-do list if they've been sent. Once they're on carriage, they're kept. And what that means is that you can also go back to it and say the patient was sent this at this time. Our advice is that is actually medico-legally protective, because at least that's taking away the question of was the patient told. There's actually evidence there that they were told. So where is the data processed? It is processed in Australia in the southeast region within a secure cloud environment. It is the closest cloud-based location that we can put it in, and it does then fully meet the New Zealand Information Privacy Code as well as the Australian privacy principles. The other key thing is that we do not train on the data. The data is not used for any training for anywhere. It is used it is a closed system from there. So that is really important. But the most important thing is that we operate from the principle of, do we need that piece of data in our system? So that's why when we're talking, you're looking at that big long context string and you're thinking, oh, the NHI number would be better. But we don't want to store that. It's not relevant to what we need to generate the information, so we don't store it. So we very much work on the principle of least holding of data. And we also make sure we don't hold identifiable information within there. So, and then moving on to the next slide. So we've talked a little bit. Some of the questions that have come up so far are around the roadmap and what are we going to do and what we're not going to do. There are a couple of things that are currently on the roadmap and I wanted to flag today. We are already set up for multi-language, but we won't turn that on without specifically engaging with clinics. We need to be confident that there is that level of understanding with the languages within there. But while I'm talking languages, we do about 75 languages, but they are mainly Asian, European languages. At this stage, we don't have the Arabic languages, nor do we have Maori within there. So, but we do have Mandarin and Cantonese and a number of the Asian languages. And if none of you are Melbourne-based, Greek's a big thing in Melbourne, not particularly relevant, I don't think. But we do have a lot of those European languages there. The other thing that we're looking at is that we've had a bit of...
Sorry? Just a question there around languages with interpreters as well. Does it handle when you've got an interpreter on the line?
It handles multiple people being in the room. So if you've got it in a language whereby you don't need the interpreter in the room necessarily if it's a language that is covered off, because it will convert it automatically to English. But if you've got a dialect and an interpreter, it will still pick up both sides of the three-way conversation within there, and it will manage it. But as I said, when it comes to the multi-language, we need to work with people specifically, because the key thing is that it gets reviewed. And it, the onus still stays with the clinician, so we just need to make sure that that is all covered off correctly. So the other one that we get a lot of feedback on is that, okay, we've told the patient to do a blood test, we've sent the SMS reminder, did they actually do the blood test? So what we're looking to do is put in the program of roadmap, looking at the inbox and seeing whether it has been completed. We're not reading the results in the inbox, and that's not part of what we're talking about, just has the action actually been completed. And then the other one, which sort of did link back to a question earlier about the mobile number, we are wanting to implement that circle of care, whereby it's not just going to the person that's sitting in the room, it's going to their carer. So certainly one of the key feedback that you get is, oh, I've got to take mum to the doctor, I've got to take time off work, I can't get there. So the message can also go to the family members. So these are things that are on our pathway. And we certainly do have an invitation out there to join the co-pilot stream. So if you are interested in, being involved in what the roadmap looks like, once you've signed up and onboarded, please contact us and we'll put you in that pilot stream. Okay, so how much does it cost? So it's 180 New Zealand dollars per month, billed annually. That includes the Medtech integration, all the note options, all the template options, the SMS secure communication. And we include 1,000 SMS credits in the subscription as well. For the launch and exclusive to the Medtech practices, we've got the 14-day trial. For clinic pricing, we're going to do a 20% discount for all practices with more than 5 clinicians. And then I know that there's a lot of people that don't work full-time, so we've got a 33% discount for clinicians working under 25 hours a week. But the thing that we really want to highlight today is the onboarding. So we want you to get the most out of your system. So we're offering free onboarding sessions up to 2 hours to set up the system, to work with you about what your templates are, what your prompts are, and really make sure we're there to handhold you through the implementation. So we've got some QR codes that are going to come up when we get to the Q&A section, where you can book in for an onboarding appointment. And although I've read out all this clinic information, I'm sure some of the practice managers are sitting there going, hang on, I still can't work that out. There'll be a QR code there, and you can fill that in and tell us how many employees you've got, and we'll get you a quote back straight away. So how do we get started with Medtech? So obviously you can join up the onboarding process, but I just want to sort of step you through what's involved. You can sign up, at the end of this call, and you'll get through the sign up, you'll get to enable integration settings. Probably also worth noting in the sign up, you do need to find your clinic in the list of locations, because we need your facility ID. The facility ID is relevant to making sure the Medtech integration happens. When you get to this stage, you will actually be asked a consent agreement. And it's the purpose of access, what we're going to read and write, and that we're, following the code of conduct with this. This will then launch an email that you need to send back to our team, and we'll work with Medtech. Medtech need to turn on the ALEX integration for this to happen. It will typically take around 3 business days for this to happen. Once that's happened, there's 2 options. We can send you step-by-step onboarding programs, or you can sign up to the free onboarding session there. But I just wanted to highlight that if you go through the process, we've still got a few days before it is all going to be active for it to work. We're going to go through and answer a lot of your questions, but we do have a really detailed knowledge base on our website. So there's already 50 articles written there, and you'll be able to go through and see the answers to those questions within there. If not, you can contact us, and we'll be able to answer more questions. And I think on that note, we're moving now to the Q&A.
Great, thanks, Cecilia. So I'm just going to run through the questions that are still outstanding. Some of them you may have answered, so hopefully we'll get through them quickly for those that are still online. So firstly, do you amend the notes in the AI or daily record, or can you do it in either?
Either.
Yep. What large language model are you using?
So we're using Azure OpenAI is the model. I won't go into too much specifics about the exact model, because we're always evaluating the model, but it is Azure, so it's Microsoft, hence it's the closed model. And if anyone wants an information, we have a pack on how we evaluate the models, but we will always be consistently evaluating the models for accuracy, latency, and price, to make sure that we're delivering the best solution. But that at the moment is the most accurate solution that allows us to, it's accurate, it's reasonably fast, and it allows for that structured format, which allows us to do the templates and the structured notes.
Probably a comment from me here is that the LLMs are changing rapidly. So I know Cecilia's tuned this along the way as she's gone on, particularly around context of the consultations, to set up the prompts. So it's not something that you can kind of sit there and do yourself. It's a high level of expertise to make that work in the background. So can the patient plan that is sent via SMS be sent in different languages?
Not at standard at the moment, but we certainly can put it on the pathway. The key thing will be that it still has to be reviewed by the clinician. So the clinician needs to be able to speak the language that it gets sent.
Yep.
This next one might be a me question.
That's for you, Alex.
Yeah, so cheeky questions. I'm always up for a cheeky question, especially if I can actually answer them. Sometimes I can. So in this case, yes, we are open to working with other partners who are in this space. The only prerequisite really is that they do need to be connecting to us via the correct integration pipes, which will be the ALEX platform.
Next question is probably for both of you as well. Can the login be linked to Medtech login so you have a single sign-on between the two?
So I think that comes down to does the Medtech use the single sign-on? Alex, we can use single sign-on, but at the moment what we are doing is we are looking at that patient, the provider context, and then going into our system to check it.
So my understanding is that's somewhat been solved. Please feel free to correct me if I'm wrong.
The patient, so the user won't need to log into our system. Yeah. The system will do it for them.
Does it display the number of SMS credits before sending? So for example, can you limit it to 2 credits per SMS?
Currently not at the moment, but we can certainly update that one. That one can be a really quick fix that we can put in pretty quickly.
Can the SMS format look like it comes from the practice, or does it need to come from Echo Health branded?
We can actually work with you on that. If you have a number that you want it to come from, we can do that customization. It'd be a customization, but a minor one that would be included as part of the subscription. But we would need to do an individual setup for that.
And is the SMS itself stored in Medtech?
It is not stored in Medtech at the moment. We are proposing that we will update the daily record if it's sent. That will then go into the notes. But it's sort of been a deliberate decision to keep the SMSs separate and outside of Medtech. Okay.
AIs are known to hallucinate, Cecilia. How are you addressing that, both now and in the future?
So look, where it does hallucinate at the moment is if it's got no transcript in there. That's the only time I've actually seen a hallucination actually happen. But where the hallucinations happen is where there's not tight prompting. So you can control for hallucinations with how you set up the system. So we have set up the system so it has very tight parameters. So as I said, with the exception of not passing through any information, it won't hallucinate. However, we also have a feedback component whereby if you do get a hallucination, you can give that feedback. What you are seeing as the models evolve, you are seeing less and less hallucinations. So to be honest, on 1,000 testings, I am not seeing a hallucination with the exception of when nothing's being passed, in which case it does get a little bit confused. But that is something where we are constantly reviewing. So we have a strong quality framework behind it, which does look for inaccuracies and inconsistencies. And then we adjust as required where we see inconsistencies. And this is where that framework of how we review LLMs that is part of the process moving forward. I hope that answered the question.
Will you use the New Zealand Microsoft Data Centre in Auckland when it's available, now that it's available?
So when I last looked, it wasn't available for what we were doing, but I will certainly, we will be using multiple data centers, but so there's no issue with it moving to the New Zealand data center if that is appropriate for the New Zealand framework. But it does need, what you often find with the data centers is not everything is available within that data center. So where we're looking at OpenAI at the moment, the only thing available that will meet our requirements is that's the closest is the Australian Southeast.
Okay. Cecilia, can you go back to the pricing page?
I can go back to the pricing page.
So question, is $180 for a single user, are the discounts stacked and are there group discounts?
Yes. So that's where that form that you can fill in will do that. So obviously, if you've got 5 part-timers, then that's discounted. Then the practice discount is on top of that. If you have a lot of only 1 day a week people, we're happy to work with you with that as well. So this is the overall pricing, but if you have any specific needs that don't address what we've put together, we are happy to work with you to meet your requirements. But as I said, that's why I've got that form that you can fill in, because I'm sure some people are going, hang on, I've got 6 part-timers, 4, and 20%, I can't work it all out.
And I guess the other comment there is if we move to enterprise networks, then a whole separate pricing discussion as well.
Yes, so for corporates and telehealth providers, there is separate and different pricing.
Great. Probably some more questions about Echo Health itself.
Yep.
Is this a beta version, and how many GPs are currently use it? And how long have we been in business, and how are we funded?
So we're a bootstrapped organization. So that means that we have funded ourselves, and we're really comfortable with that approach. What we are doing is we are only launching with partners. So we are not going out and picking up users that are just using it and then copying and pasting into the system. We are coming with partners. So Medtech is our first big partnership. We have some proof of concepts out there in Australia in corporates and telehealth. And we have a small group of users that were early adopters of the system with Medtech. But this is our big launch with Medtech, and we're very, very excited. Oh, how long have we been around? Sorry. We've been working on the solution for the last couple of years and have been really working with partners and coming up with the solution that meets the requirement. So we've gone through a number of steps associated with that, from MVP to pilot. But as I said, once we got past that stage, we really wanted to make sure that we weren't just another scribe that you copied and paste, that we had that deep integration with practice management solutions.
And Cecilia, can you talk about the clinicians involved and clinical governance?
Yes, so we have a number of clinicians that are part of our clinical advisory group, and we have worked with probably 400 different clinicians across different specialties over the last couple of years to make sure that this is clinically appropriate, from GPs through nursing, through specialists, through psychiatry. And so we do review this, and we do have a clinical framework. And as part of when I was talking about the framework on the LLMs and choosing that, the clinical governance lead also needs to review any changes and to make sure that we meet that accuracy component and clinical need component.
And when does the corporate pricing kick in?
Well, I guess I don't really have the answer to that. I think that's a case-by-case scenario. So I recommend that you talk to us directly, and we're happy to work with you to come
More
up
than
with
happy to work with corporate clients to onboard swiftly and use the platform. So please reach out.
Okay. Back to some more functional questions now. So how do notes transfer from or to the patient transferring to or from a practice that uses a different practice management system, i.e. not Medtech?
So at the moment, it would be through the copy function. That's how it would do. If you are not using Medtech and you are interested in this solution, we are already significantly underway with a number of other practice management solutions with regard to getting integration, and we'd be happy to talk to you directly about that. But at the moment, it is a copy if you're not integrated into Medtech at the moment.
Yeah, I suspect in the New Zealand market, they'd be interested about NDC there.
Sorry?
About the other competitor in market.
Yeah, so, well, I think I've just got to be a bit careful about some of these conversations at the moment, Andrew, but just to let people know that of the other specialty allied health, we've got conversations underway where we're looking at doing getting that up and running reasonably quickly.
Great. Can you set up tasks for providers based on the discussion? E.g., you'll say you'll do a referral and it puts in a task for you to remind you to do the referral with a date set.
There's no reason why it can't do that. We're happy to put that on the roadmap. So if you like, I just put out, if people are interested in being involved in making sure it evolves to a way that meets their needs, please don't, please join up to the pilot co-design group.
And probably related to that is how are the dates actually determined, right? So in the patient to do plan, if you use the word soon, how does it, what does it use as the date?
So soon's probably a bit of a problem. Soon will probably assume it's today, but if you say a fortnight, week, it'll calculate it. 4 days, it'll calculate it. So it looks for the time series that's mentioned in the transcript, and then puts the time there together. Soon is not what we'd call a time series word, so that's probably not going to pick that one up. Soon, I think it would. I don't know what soon would do. I would assume it would be today.
And Cecilia, will it work on phone consultations?
Absolutely, absolutely. So we've been doing a lot of testing to make sure that this webinar went really well. So we've tested it on a number of different platforms, and we are actively in discussions with a number of telehealth organisations. So we would expect this to be rolled out across a number of key telehealth providers in the next probably coming quarter.
Yep. And specifically there, will it integrate with Medtech Connect?
Alex, I don't know about Medtech Connect, so I might need more information.
So I'll apologize too. I'm actually currently coming to the end of my maternity leave, so I'm a little out of the loop, but that's something that we can certainly follow up on.
So that's one for a follow-up. What's the support model? So if there's issues with Echo Health, do we contact you directly, or do we go via the Medtech help desk?
Us directly. And we have a support desk that will return any immediate queries with, they'll be graded and there'll be a time frame turnaround on that. Most of them will be pretty straightforward, which can be provided with a response and a knowledge base response back straight away. Probably the challenge can be is that we are using things like OpenAI, Azure, and they sometimes can go down. When they happen, we will share a service disruption note to everyone. They sometimes go down for about 10 minutes occasionally. Rarely, but it does happen.
Okay. And what's the cost per SMS after 1,000 credits?
It's a sliding scale, and it's generally priced on par with whatever the practice management software, whatever the pricing is that you pay for Medtech. I don't recall the number off the top of my head.
Okay, so we'll get back on that one. What's the plan for I'd say non-practice management systems? So are we looking at other system types, and can you comment on that?
I probably need a little bit more information on that, Andrew, to answer that question.
So non-GP systems. So we're looking at non-GP systems.
Allied health, we're certainly working down that space. We're working with specialists as well. So
we're looking at some acute settings as well, emergency
Yeah.
settings. So I think the answer is yes, but we're reviewing options.
It's probably just worth stating that in the last 2 days, I've had conversations with psychologists, physiotherapists, emergency health, telehealth, nursing. So, and that's just been in the last 48 hours. So we're certainly across a lot of areas.
So Celia, do you want to comment on your mental health capabilities as well then?
Look, I'll tell a funny story on the mental health one. Is that we are really strong, and we did a lot of work with psychiatrists up front. One of the key things that we found with mental health is that there's a couple of really key components of why a summary and a to-do list is really relevant. On a clinical side, if people are changing drugs, they've got washouts that need to happen, and there needs to be quite specific items that need to happen with each drug, as in 25 milligrams down for this week, add on the new one. So it's really strong at picking up that level of information. But it's and one of the feedback is that with this psychiatrist is that the summary and the to-do list is really quite useful, because sometimes, particularly when they're acute, they lack insight into their illness. So this really can help with that process. But one of the things that we did when we were learning is that one of the questions that came up was, what if we talk nonsense, like nothing to do with the why someone's in? And we have been working on this for a while, so it was around when Taylor Swift was coming out, so we did some testing with our group about talking about Taylor Swift for about 15 minutes of a 20-minute consult, and of course it completely ignored that and just focused on the clinical side. And I was then following that up with a psychiatrist, and I told the story, and they said, oh no, if I've got someone speaking that much about Taylor Swift, maybe they've got actually some obsessive compulsive components to it. So what we do is we make sure that when we're reviewing this, we know the context in which it's being spoken about. So if we're talking in a psychiatric setting and people are showing obsessive components, it will pull that out as part of the clinical component. Does that answer the question, Andrew?
Thank you. How do we sign up for the pilot co-design group?
So first of all, we'll need you on board. So sign up for the onboarding so we can get the system in, and then just email us. And what that means is that we'll be in contact with you regularly, and we will set up some meetings. So really, once you've onboarded, just let us know in the onboarding process, and we will include you as part of that. And what that means is that we'll have some regular meetings about what needs to happen, and what that will mean for you is that we will turn features on sooner, and with the caveat that you just need to check that it's all working correctly.
Cool. Not sure about this question. So the question is, can we see the patients when we do the phone consultation? Now, I'm assuming we can answer that in 2 ways, right? So one is, can we see the scribe and the information in Medtech while we're on the phone? And if we're using a telehealth video tool set, can we see the patient there and the scribe?
Yes, it just depends on how you've got. That's more a video screen. Basically, it's embedded in the background. You can have as many screens, like I'm doing this presentation today with multiple screens, multiple cameras. So yes, you certainly can, but that more goes down to your camera setup and your screen set up rather than the system. The system will sit there in the background and it will pick up everything, and you can keep everything open. I'll just give you the example in prepping for this meeting. I actually have a script of that consult recorded, so I was able to run that because it went for 7 to 8 minutes, and then keep using the system, and everything kept working. So you can keep going with everything, and the recording will keep happening.
And last question: are you talking to Health NZ Te Waka Ora?
We are talking to a lot of people, and I'm going to actually lean back to Justin. Do we have a meeting set up with them to date? I'm not sure if we do, but we're talking to a lot of the key stakeholders in New Zealand.
Yeah, I think that the government level, obviously there's a lot of benefits to the whole system from a solution like this. Whether it's state government, whether federal government, whether it be national governments like Health New Zealand. So we're talking, as Cecilia said, I'm not going to answer it directly, but we're talking a lot of people about the solution and the broader system benefits of what can be provided.
Great. That's the questions. So Alex, probably hand back to you to wrap up in terms of next steps, us getting back to those questions that we've noticed, particularly around Medtech Connect and a few others as well. And of course, invite people to scan the QR codes there and begin the sign-up process, I would say.
So thank you to everybody for coming along, and apologies, we've run a little bit over time, but I like to think that actually is a very good thing. It shows that there's quite a bit of engagement, quite a bit of feedback, and good questions out there, a lot of really good questions. Obviously, this is quite new for the New Zealand space, so we're really interested in hearing all of your feedback and all of your questions, and any questions that might be simmering or that you might think of at 3 a.m. when you're trying to get back to sleep. Because I know that's when all my questions always pop up. Please don't hesitate to get in touch with us and or the Echo Health team, because we really want that feedback. We want those questions because that's how we learn and how we make these products, these integrations better. So aside from that, thank you all so much for joining us today. Any questions that were missed, please do rest assured that we will be following up on those we could not answer live. And any that have been missed, we'll certainly follow up. We will be passing on all of these questions to the Echo Health team as well. So all of that, all of those questions, all that feedback, that's been recorded. So we will get you those answers that you seek. Thank you so much to Cecilia, Justin, and Andrew for taking the time to share all of this information with us today. We really do appreciate it. And thank you to everybody who took the time today to attend. We know you're super busy, so we really do appreciate you taking the time to come learn about the product, ask those really, really pointed questions, and provide that feedback, because that's essential to us providing those services in a way that actually suits you guys and not the other way around. So thank you all, and enjoy the rest of your week, and have a wonderful weekend. We're over halfway.
Thank you, everyone.